Now, many of you, I'm sure, have heard the terms eczema and dermatitis. And those terms really are interchangeable. They both refer to skin that is inflamed. Now, inflamed skin can be inflamed from irritation by contact with a harsh soap or detergent or chemical, or it also could be an allergic reaction to something like poison oak. But when dermatologists talk about eczema or dermatitis, they're generally referring to a specific type of condition called atopic dermatitis. This is an inherited condition, and it tends to occur in people who have a history either in themselves or in their immediate family members of one of the atopic diseases. Well, what are the atopic diseases? These are asthma, hay fever, eczema, and hives. And what they are, they're conditions in which your immune system is overreactive, oversensitive to a variety of different stimuli. If you have hay fever, pollens, dust, dog hair, cat hair, clog up your sinuses, your nose, your eyes run. If you have asthma, you have trouble breathing because spasm of the bronchi. But with eczema, there's an overreactivity of your skin. People with atopic dermatitis have very sensitive skin, very reactive skin, have a much lower threshold for itching. So eczema or atopic dermatitis, I often say, is not only a rash that itches, but it's an itch that rashes, because when you scratch the skin, when you have atopic dermatitis, you get more of a rash. And then there's a cycle you get into of inflammation, which leads to itching, which then leads to scratching, which leads to more itching, which leads to more scratching, more inflammation, more itching, more scratching, and hence more rash. People with atopic dermatitis generally have very dry, sensitive skin. They have an abnormality of their outer skin barrier. So the outer layer of your skin is comprised of cells that interlock like this, that act as a barrier. But with atopic dermatitis, that barrier is broken, so things can get through and the skin is more easily irritated. Now, atopic dermatitis occurs in 3 different phases. First, there's the infantile phase. This usually starts a couple of months of age. It's more common to be on the face and the outer or extensor extremities, the outer parts of the arms or the legs. It's often oozy, weepy, commonly gets infected. These infants are very itchy, they're fussy, they don't sleep well. Sometimes there are food allergies, particularly to milk products, very early on in life. The second phase of atopic dermatitis is the childhood phase, which starts at a couple of years of age, and this tends to occur more in the flexural areas or where the body bends. So inside the wrists, inside the elbows, behind the knees, on the neck. And with the childhood phase, the skin is very, very dry, very itchy, it's thickened, and people scratch, and very commonly they get secondarily infected. So people with atopic dermatitis have this abnormal barrier that makes their skin more easily irritated, but also this abnormal barrier makes them more easily get infections. The third phase of atopic dermatitis is the adult phase, and it's kind of like referred to as the dishpan hands. Adults get an increased susceptibility to their hands getting dried and irritated and getting rashes. All patients with atopic dermatitis need moisturization. One of the key things is keeping the skin very well hydrated using a good moisturizer, and honestly, the thicker, the greasier, the messier the moisturizer, the less elegant, the less you like it, usually the better it is for you. And those of you with eczema with real dry itchy skin have learned things in a Vaseline base are much more effective than a lotion. Atopic dermatitis is going to be treated with topical cortisone creams and ointments, some non-cortisone-based anti-inflammatory creams and ointments. When severe, sometimes internal cortisone. We almost always use antihistamines to control itching, and occasionally in very severe cases, we also use phototherapy, which is ultraviolet light treatments in a specific type of light box we have here at the office.